Chantix is the most popular anti-smoking drug on the market, with annual sales of nearly $800 million. But a study out today raises new safety questions about it. Chantix has already been linked to an increased risk of suicidal thoughts and now to a higher risk of heart disease. We asked Dr. Jon LaPook to tell us what we need to know about these new findings.
Today's study is worrisome news for the more than 7 million Americans who have taken Chantix. A new analysis links the pill to a 72% increase in the risk of heart problems. Johns Hopkins' Dr. Sonal Singh led the research.
It is causing the same problems that we are trying to prevent. That's why it's not worth the risk. We need to prevent cardiac disease among smokers, not increase it.
The review combines 14 studies involving more than 8,000 patients. While a 72% increased risk sounds alarming, a companion editorial titled, "Is it a Heartbreaker?" notes that cardiovascular problems, including chest pain, heart attack, and stroke, are still rare, occurring in only about 1% of patients taking Chantix. The drug maker Pfizer questions the way the analysis was conducted. Dr. Gail Cawkwell was Vice President of Medical Affairs for Pfizer.
We will continue to do a more in-depth look, as the FDA is asking us to do, but to date we have not seen evidence of important risks to the heart health of patients from Chantix.
In mid-June, the FDA warned Chantix might be linked to a small increase in heart problems in smokers who have heart disease. The agency tells CBS News that based on this new study, it will evaluate expanding that warning to include all smokers. That review could take a year.
John, I wonder, with these apparent risks, does it make sense for doctors to prescribe Chantix at all?
Scott, yes, with an asterisk. Smoking's horrible. It lowers your lifespan by about 10 years. And if you stop by age 50, you can regain about 6 of those years. So even if it turns out that Chantix does increase heart risk a little bit, and I can't wait for the FDA to complete their study, then it still might be worth the risk, because the possible risk of having all of the side effects of smoking might be outweighed by taking a medication. Now, in that said, in my practice, I might decide to start with the other medications first. But if they fail, then say, here are the risks and benefits of Chantix. Let's give it a try.
Does Chantix work better than other medications?
Scott, it does work a little bit better, say about 21 to 23% at a year. That's a little bit better than other things like bupropion, which is an antidepressant, or the nicotine medications, and even biofeedback, other things like that. So it's tempting to try Chantix first, but I think until we know better whether this risk is real, for me in my own practice, I'm going to put it aside. I'm going to try the other ones first, but I will not hesitate to use it if those other medications worse, because at the end of the day, there's nothing worse than smoking.
Thanks, John.